Sherry does, that's interesting. Yeah, I'm good. I just washed my hands though, so I just don't want to touch the floor. I'm just gonna sit right here. I always use this as a garbage. Oh, they only sent the 500s. We might need another one of these.
Okay.
Okay, you might have to hand it to me.
Okay.
Or I can get it, I guess.
No.
I always use this as my garbage. So, always remember, this has a vacuum in it. If you, because you have to prime that, well, we can do that now. And then you have to push down on this to break the seal in there to get the bottle to work. If you don't close the clamp first, you will let your vacuum out. I can show you a little bit so you can see what happens is on the air. You hear that air?
I hear it, yeah.
So if you don't completely close this, all your suction will come out of here and then it won't work.
Okay.
So, and you may do that once and then you'll be like, oops, never do it again. So always close this before you sign, and then don't take this cap off until you're ready to use it.
How do you close that?
It's just a roller clamp. I can't let you do it now or we'll lose our vacuum,
Okay.
but it just pushes. And it does get a little bit hard to close it all the way as it comes down. So what it's doing is it's pushing on that tube in there. So when it goes like that, it's just squeezing it, which you can't do on your own. It's a hard tubing. But it squeezes it down so the air won't come out. All right. So this, you want to wear some gloves when you take the old dressing off because that one does have a little bit of blood on it. All right, you ready?
Yep.
Okay. So they make this tape supposed to not be real irritating to the skin, but if you just push down on the skin a little bit and do it slow. Is that hard?
That's a waterproof one.
Yeah, it's great, huh?
Yeah, I took a shower this morning. I was careful with it.
Am I hurting you?
No. Tickles once in a while.
Sorry. I know most people like it if you like, it gets real itchy under there.
Mm-hmm.
See, that's what you were saying, it was itchy.
Yeah.
On your left arm.
Yep. So just be careful because it does want to come off in one piece. And just make sure you untangle all your tubing. That's my daughter calling me. She's gonna
That's
say, hey,
nice.
Mama. Yeah, she always calls me.
Nice.
All right, so then this is sterile. Everything in here is sterile. Usually in the home, a sterile procedure is non-existent. It's clean. You have to just be happy with clean. But you can try your best to maintain it that way. So this dressing is what we cover it with. We're gonna save that for the very end. And they tell you to take your gloves off before you put that on because it sticks to you. So everything in here is sterile. So once you open it, you don't want to touch anything on the inside. All right. You can probably just put those on over top of your other gloves if you want to. Then if you get something on them, you just take them off and you don't touch anything else. So you can touch the inside because that's what touches your hand. I almost always put it on backwards. And then with this one you can touch the outside.
This is itching.
Yeah, I'll scratch it for you a little bit. That's just because it's all closed in on,
It's a good inch. A good inch.
what,
I mean,
you
it's
mean here?
stronger.
Yeah,
So that's like a healing inch.
exactly.
Right. So this is, for this tubing, if you should need to clamp it off, if it was bleeding or anything like that, I never have had to use these. And I pray that I don't. So this, there should be a cap. Yeah, that's your new cap that you put on there when it's all done. So this hand, I'm going to, it's not going to be sterile anymore. Will you hold that? And then we'll just take this off. That's what I mean, like in the house, it's nearly impossible to do sterile. She must really want something.
Is it your daughter again?
Yeah.
Oh.
All right. So this
You
cap,
want to take a break and say hi?
I will in a minute. Let me get your
Okay.
drain started first.
Okay.
So then don't touch this on anything when you take the cap off. And that just twists and unsnap. Don't put your clean one in here because then you might get them mixed up.
Mm-hmm.
That just goes in there and you'll feel it. Oh, it should click. Maybe I didn't hear it. Yeah, you can hear it and feel it snap. And you know it's in there. And that's it. And we open it up. Sometimes, you should be able to just open it all the way, but sometimes that hurts. So you could,
Because it pulls a little
Yeah.
bit like the suction.
but you gotta open it all the way to get the vacuum started. I'll just lift this up a little higher so I can reach it. How you doing?
Great. No problem at all.
That's good.
I like you.
Well, thanks. That's good.
Mm-hmm. You're really smart.
Thanks. I've been doing this for almost 30 years.
It shows.
And I've worked mostly in the ER too,
Oh, do
which
you?
is so much fun.
And that's
I'm sorry
something the
people get
ERs,
sick.
when they brought me back in there, they're so kind.
Yeah,
And there's
that's
multiple.
good.
There's maybe 7 different nurses that are going by. Now when you do this and they give you detailed instructions.
Well, I just think that it makes things a lot easier for people when they can understand what's happening. And if you explain it,
Yeah.
it takes away a lot of
Calms
anxiety.
down.
Sure.
Yeah.
And you
That's what-
can't come in with this like hyperness because
No.
then they're gonna be hyper.
Right.
You just have to be calm.
Well, they're so calming. The nurses are phenomenal.
Well, because you've seen everything. There's really not a lot that can surprise you
Mm-mm.
in there, you know? That's the excitement of it. That's
Do
the
you work
draw.
for the
That's why you
VA?
do it. No, my cousin works there though. She works in the pharmacy. And the other one, she works there too.
Mm.
She's a nurse liaison or something.
What's that feel like, Dad? Coming out? Do you feel anything?
Nothing.
You feel nothing?
Nothing.
Because they kind of said on the company's video said you might feel a sensation or
That's what
discomfort.
she said.
Yeah, I
Yeah.
think we're gonna have to do another tube. This one's probably gonna fill up, and then
Really?
once you get
Wow,
It's filling up. I don't even see.
Down here, Mom.
Yeah.
Oh.
so never ever take off more than 1 liter at a time.
Which is 2 of those things.
Yes.
Two of those.
These they sent you the small bottles, so you can do 2.
It's going,
Do you
going
know
quick.
Dr. Moore? He's the anesthesiologist over at the hospital. He is really some guy.
Well, that's good. You know, I think it probably is easy to be a caregiver for you because you're very kind and you're very optimistic and you're grateful.
Oh, yes.
Sometimes
Oh, that,
people are a little bit
the, op-
less like that.
the operating room just astounded me. I
Good.
mean, it's complete.
Okay, so here, go ahead and take a hold of that. Yeah, and then hold it just like that, and then take your thumb and push that roller down to this end. And you'll feel you have to push pretty good, and that's gonna close it up. Try not to pull on him too much, that's it.
All the way down?
Yep,
Oh, it's hard.
yeah, so now you know. And then if you look, it's not dripping anymore. So I'm gonna go get us another bottle, and we're gonna switch it.
Let me get one of those again.
Sure, if you wanna grab it. And then we'll give you a little break too. It's kinda good. You did great.
We're coming along 100%.
And this looks good. It's, I mean, it's amber, so it's kinda hard to tell if there's blood in there. There probably is a little.
Looks like yellow to me.
Clear though, I don't see any sediment or junk floating around. Thank you. I always just save these, even though we don't need this one right now. I save them. All right, do you want to close it or do you want to try it?
I'll try it.
Okay, just close it all the way down to the end.
Is that it?
Yep.
Okay.
And then this, there's a little handle here, and to see the arrow goes that way, just pull that off that way.
Okay.
There you go. And now you have to push that down to break the seal.
The whole thing?
Yeah.
Okay. Is that it?
Nope, a little bit further.
This whole thing?
Uh-huh.
Okay.
You feel the difference?
Yeah.
So, I mean, you would have known, because you would have hooked it up and nothing would have
Nothing
happened.
would happen. Okay.
So then you would look at it and say, oh, maybe this needs to go in further.
Okay.
And then you got it. So now it's closed. And we're not going to take the cap off until right now when we're ready to hook it up. I don't know why they always get tangled up. Okay. You do not have to put this on the floor because there's suction in there. There's vacuum in there. I could hold it up like this and it would still come out.
Oh,
Okay.
It's going to be better if it's lower though. I'm always afraid of it going back in, but these have anti-reflux valves on them, so they won't
Okay.
go backwards.
It won't
Okay.
go back in.
No, but if you wanted to put it on a table instead, it would be just fine. Do you want to unhook it? Do you want to try? So what you're going to do, are your hands clean? Did you wash them?
I'll go
Maybe I
wash
should.
it. Yeah.
I'll let you unhook the next one.
Okay.
You can go ahead and wash. I'll do this one. But always wipe this off in between. Would you hold that one, please? I don't want to sit it down on anything. All right, and then it just slides in there and it clicks. Did you hear that little tiny
Yeah, I
click?
heard it.
All right. Who wants to try to open it?
I'll open it. So just rolling it the opposite way?
Yep. So if you can imagine, when you close it, it's just squeezing that. And then when you open it, there's no pressure on the tubing anymore, so then it can come through there.
So what do I do with this?
I'm gonna take that and we'll throw it. I'll have to show you how because you gotta dump this down the toilet. You
Oh,
can't,
that's right.
yeah, you can't put it in the, and I saved these. I'll just put this back on there so it won't get on anything until we can dump it out. How you doing?
Fine,
You are too, huh?
I am.
Good. Yeah, go ahead and wash your hands and then you can unhook it.
Very interesting.
Yeah, isn't it cool?
Yeah.
It's
Very,
pretty easy.
yes, the way you have it,
Yeah, and this also, when, like check this, they have it stitched in there so it won't come out, but just make sure there's no excessive bleeding from around there or redness. Like there's absolutely no redness around there. So that site looks very, very good.
It's just discolored from the operation, it says, or redness?
What do you mean, like right there?
Yeah.
Yeah, that's just because it's a foreign body in your body.
Right.
Your body's tendency is to reject that.
Okay,
It's like, get this out of here,
right.
So it's gonna get a little bit red, but you would be able to tell. See, this redness is from irritation from the tape. Some people are sensitive to tape.
Pretty hard to pull that out too. It's easy.
Not really.
Okay.
Yeah, it would come out very easily.
So you can't.
But this
tug
is
on
a
it, yeah.
sucking chest wound.
Right.
If this ever comes out, you have to put like a Vaseline gauze over it
Which
right away
Okay.
because air will just keep coming out of there.
Oh,
So,
so that's
it's-
why they gave him a Vaseline gauze
yes,
from his wound. They had to take care of it for those few days.
yes, that would be a sucking chest
So
wound.
he has a lot of
Which
those.
means that the pressure outside would suck air. It
And
would
then your
cause him
lung
a problem.
collapses?
Yep,
Yeah.
that's exactly right.
Okay.
So if that should get pulled out, you get that Vaseline gauze and you cover it up right away. And then it'll be fine. And that's what they do when they pull them. They put that on there and
Right.
then and it'll form a scab so fast.
Right.
When you pull those, they
So
scab in a
when they
day.
did pull it, the day they pulled it, they taught us how to redress it with the Vaseline gauze. Yeah.
Until it'll close, yeah. It'll start to heal as soon as you take it out. So it'll take a
interesting.
couple of days and then it would be closed up. Look how fast that filled up.
Yeah.
We're all done, so I'm gonna,
Did it
So there
stop
might-
now?
yeah.
There might still be some more in there, but we can only take
You
out
can only do a liter.
a day. Okay.
Now, if I was in the hospital with a doctor standing beside me, he might say, yeah, go ahead and take some more. There's probably more. But I'm not gonna do that
So
here.
that's why it's gonna be important to do it every other day then.
Yeah, because it's gonna accumulate probably pretty quickly.
Okay.
You did fantastic.
Thank
No
you.
pain, no nothing.
Nothing.
And I think that, for now anyway, until we learn how much and how quickly you're gonna accumulate, I just think it's better to leave a little bit in there for comfort wise too. And then one day, we're gonna find the bottom of it, and your lung's gonna go,
Beautiful.
that's the plan. Are you ready?
Yep.
So this cap right here, here, you know what, we have another pair of gloves right here. We'll just let you put them on the clean way because you're not sturdy. All right. You can grab those gloves right there.
Gosh. Okay.
Never fails I drop one. So I'll just hold my hand in there. And then when you're focusing and you're just a little nervous because somebody's watching you, then you always drop it. Okay, so what you're gonna do, this cap is not sterile anymore because we opened it to the air, but it is clean. And that's what we're gonna put on there. So when we take that off, then you're gonna take a fresh alcohol and you're gonna wipe that cap, the cap that's on him.
Okay.
This one doesn't matter. But you're gonna wipe that off, and then this sits on there and it twists. Don't do it too hard because you can break this little, it's a nipple. You
Okay.
can break that off there if you do it
Okay.
too hard. So you just wanna push it on there a little bit and turn it to the right.
Okay, so I have to.
I'll
wipe
hold
it
this
first?
for you. I'll hold this for you.
Okay, take it off and then wipe it.
Yep, all you gotta do is pull very gently. It doesn't, yeah, see how easy that was?
Yeah.
I'll hold it for you because it's dirty. Now you take that alcohol wipe and clean that off real good. And after you clean it,
I can't do it with these gloves, they're too big.
I know. Well, you can get some smalls if you want. Clean gloves are okay.
Yeah,
And then just make sure you don't touch that again.
okay.
And then grab that cap from that end. Can you reach it? That's it.
And you
Push
put
it on gently, straight on. And then, now do you
didn't
see,
hear it
it might
click.
have to go on a certain way because there's,
Oh.
just keep turning it
Oh,
and then it'll snap. Keep turning. You see that end right there? It has to line up with that.
oh. It's like my food processor.
Keep turning. Did it click?
No.
Push
It
in a
doesn't
little
like-
bit more. And
Oh,
then
I'm gonna
see
pull
what
it
has
back.
to happen. Hold on, let me show you.
Don't pull on the catheter.
Let's focus on what's happening. See right here how that lines up?
Yeah, it should.
There's
line
that
up.
little
Yeah,
round,
Yeah.
right? So you have to, and then it might have to go on this side.
I heard it click.
Okay, so go ahead, you try it again. And you may just have to hold that a certain way until it gets there. You okay?
Oh, yeah.
Sometimes that will stimulate a cough.
Yes, there's an association.
It clicked.
Did it click?
Yeah.
Good job. And that's it. So now, what we have to do is the dressing. This little rubber piece.
Wait, we're not getting any more than 4, so I
No, it doesn't matter if
Do I
that
put
touches
that down?
anything. You can.
Okay.
And this goes up against there. And then you coil that up like that.
Oh.
Put this on there. Now, would you hold that for me, please?
Okay.
And then they say that it's really hard to put these, and I will testify to that because, you all right?
Yes,
Okay, these things get very
I've had a
sticky.
dry cough for about a month.
Yeah, he's been coughing.
That's Lasix.
Huh?
Well,
Like-
That's
Lasix.
part of the.
That's the water pill. Makes them cough.
Yeah, it dries you out, so. All right, now I got it. You can let go.
That's nice and big.
Good fit.
And then there's an end over here that is split. And then just push this down as you take it off.
Oh, I see.
Okay.
Yeah.
Take that off.
Yep.
Take that off.
I tried to avoid your nipple this time. Last time it was completely covered up.
Oh, everything comes. Okay, yeah.
Oh.
That's nice.
Mm-hmm.
Nice and tight. So you can take a
Yep,
shower.
and then just check and make sure it's covered all the way around there. So when you take a shower, nothing leaks in.
Is this
And
the
that's it.
waterproof one? Is that
Yeah.
waterproof?
Yeah.
And it's, you can see it's really stuck on the skin.
Yeah.
And you know what? There's an extra one. So just hold on to it. And if, God forbid, that comes loose or something, just put it right over top of it.
Oh, yeah.
Like, let it dry first, but it should be fine.
That's a good job.
Nice job.
Mm-hmm.
High five. Thanks. Yeah, you did good too.